Today we're going to look at macroeconomics and how it's related to healthcare. So we're going to talk about the macroeconomics of healthcare. When it comes to microeconomics versus macroeconomics, when it comes to spending in general, macro looks at large. So macro looks at the large scale, the economic system as a whole, things like gross domestic product, GDP, expansion versus recession, rich versus poor, coming closer to or further from equality. And so micro, on the other hand, looks at the individual decisions, the how a price is determined, or how much usage of a specific type of service or good is allocated. Now, when it comes to healthcare, we have what are called properties and institutions. Macroeconomics, we have properties and institutions. So the macroeconomic properties, which is what is affected, is going to be things like growth, dynamics, distribution. And so the macroeconomic properties in general is going to be GDP, unemployment rates, interest rates. Okay, so it's the what is. And in healthcare, the macroeconomic properties are going to be things like total healthcare spending, healthcare employment levels, healthcare price levels, insurance premiums. So that's the outcomes, what is affected. Macroeconomic institutions are what affects or what facilitates those properties. And so in macroeconomics, in general, the institutions are going to be things like the government, laws, money. Now, what facilitates the properties in healthcare is going to be the healthcare professionals, the organizations, the doctor's offices, the drug companies, the hospitals, and the financial structure, which is the insurance. And that one is a big one. So this looks at how healthcare spending relates to income. And each dot represented here is a combination of the two between health and healthcare spending and income. And as can be seen, the higher income goes, or the higher income is, the higher healthcare spending is. However, as you can see here, the slope here is 0.228. And so what's happening is healthcare is rising faster than income. So whatever income goes up by, healthcare goes up by less, percentage-wise. Dollar-wise. So it's a pretty big disparity, but the trend is there. So that's how you look at healthcare in the large scale when it comes to macro, between spending and healthcare and overall income levels.